neuroscience, quantum physics, biology, plant medicine, non-dual tantric meditative practices. We will be exploring these concepts with experts to provide insight. Get ready to melt reality with us.
Dr. Yesenia Almaguer is an addiction psychiatrist, ketamine-assisted psychotherapist, co-founder and co-owner of SOHL, a concierge mental health consultancy, as well as the founder of a charity called Worst Patient. Worst Patient assists doctors in treating their mental health, trauma, and addiction. She is trained in multiple therapeutic modalities and is also the only psychiatrist who is a certified intervention professional in the Association of Intervention Specialists. Through her personal and professional experience with ketamine-assisted therapy, she believes psychedelics help individuals reach parts of their healing that traditional therapy is not able to reach. Our other guest, Andrew Dits, is the CEO of a concierge medical health consultancy called SOHL, which he co-founded and co-owns with his wife, Dr. Almaguer. He started working in mental health and addiction treatment over 15 years ago and has worked for many of the private recovery groups in the field today before creating his own company. His personal experience with addiction and mental illness exposed him to many programs and different paths of healing, which have helped him understand the different avenues of a person's treatment process. He currently supervises, trains, and oversees the 300 coaches and case managers who work throughout the country on cases ranging in complexity. Welcome, Dr. Almaguer and Andrew.
Thank you. Thank you.
Wonderful to have you here.
Yeah.
Wonderful. Thank you.
Great to finally be here. I feel like it's been a journey.
To just start, yeah, right. Well, it certainly sounds like it, and that's exactly what we want to explore with you today. So it's just wonderful that have you join us. And why don't we start, Yesenia? Can you start by sharing with us an early memory that inspired you to focus on the emotional state of a person and ultimately move you into the study of psychiatry? What was it that really moved you and triggered that exploration?
Thank you, Jody. Yeah, some psychiatrists or doctors really have like that first memory of like something that triggered them into the field of medicine. I would say for me, it was never like I want to be a doctor. I wanted to be a dentist, but it was more that I was raised in a border town, McAllen, Mexico, Texas, and I was surrounded by a plenty amount of trauma, by addiction problems. There's a lot of drug dealing situations happening in the border. So I had a lot of friends, family members died of addiction problems, of traumatic experiences related to that. So I knew that there was something wrong, but in the Mexican culture, you see something, but you don't say anything, right? So when I was seeing all these things happening, all these events, I got more curious into psychiatry, into what is it that it's actually happening? What is the big capital T trauma and what to do, right? So that's when medicine fell into my hands by accident. I applied to a grant and I got it to go to medical school, and it all started from there, and all the pieces just kind of aligned themselves.
But look at that. That is extraordinary in itself, coming from a small town and then applying for a grant and getting accepted. Congratulations on that.
Thank you.
So Andrew, you had a different, more challenging childhood. Could you share with our listeners sort of what you had to face growing up that led you into the use of alcohol and drugs, as I understand it, which in turn led you to study addiction?
Well, it's interesting, your question. One thing I wanted to say about that is we do, Yesenia and I, we just went and did an intensive, and we looked a lot at our own lives and backgrounds. And I don't think I had a more challenging upbringing than Dr. Almaguer.
That's fair. That's fair.
Yeah, there's another thing we say in trauma treatment, one person's trauma is another person's Tuesday, so
Yeah. Yeah.
it's comparing traumas is it's not always accurate. But I would say that um, and this is something that's really important to me is talking about attachment. And I know that it's a buzzword now, right? Bessel van der Kolk's book, Body Keeps the Score, kind of like launched us all into a different understanding of trauma. And then recently there's been a lot of work on CPTSD and like looking at an even like more refined level of trauma and how that affects people over time. And we have these buzzwords that have popped up about attachment theory as well. And for me, to answer your question, attachment and attachment trauma was the thing that created all of it. And for years, I said, I came from such a loving family. Everybody loved each other, except for my parents didn't love each other. And we were always given everything, right? And so how is it that I struggle from so many addictions? I feel internally so much like people who have gone through extreme trauma. What is the source of that? Where does that come from? And it was a question that I've sought to answer over the last 15 years of my recovery and throughout my life. And, it really wasn't until I got into our relationship and we were able to explore connection much deeper and more intentionally. I've had to do a lot more work over the last 5 years of our relationship than I ever had to be able to be in this relationship and be connected. And I think that when you say, what is the one experience underneath it? I think it was growing up in a family where attachment was really confusing and really chaotic. And love was also mixed with enmeshment, hurt, pain, codependency, in a way that was not easy to point the finger, right? It wasn't like somebody was getting beaten up or assaulted, right? It was very, very different. So to answer your question, and I will just add that I'm currently writing a memoir about this, about attachment trauma through the lens of my life, because I think it's something that is so important for people to hear. Are stories like mine, which aren't necessarily extreme, but which still feel extreme.
Yeah. Yeah. So clearly two different lenses to look at the world, which is always a great way to do it. So a long time ago, when I was a graduate student in neuroscience, I studied the brain and I studied how we thought the brain exerted control over addiction. In my day, we focused on dysregulation of dopamine systems. Well, different systems, but I sort of focused on dopamine systems. And, this is a very rudimentary approach to such clearly a complex system. Jasenia, tell us a little bit about how you view the brain's control over addiction and maybe, enlighten us a little bit as to what we've learned over the last, I hate to say, 30, 35 years.
Yeah, the brain is so beautiful and so fascinating. And we've done a lot of research, yet we're still hungry for more because it's not enough what we know. Yeah, everybody knows about the addiction, the dopamine, the nucleus accumbens, right? Food, sex, drugs, alcohol, it all acts in the same part of the brain. And there are more studies, on different kind of modalities to treat this. There's signal waves, there's TMS, right? That they're trying to do all these research trials. Some people say it's helpful for the depression and to target those kind of parts of the brain to help with the depression, the anxiety, PTSD symptoms. But still, there's not enough clinical research to do that. That's why people have turned to turn to other modalities like psychedelics, because we are stuck with the old medication or old treatment of SSRIs, SNRIs, typicals. And it's still not working for some people, right? So what do we do now? Psychedelics, TMS. We already tried ECT. ECT has been going on for a long time, electroconvulsive therapy. And it still doesn't work for many people. So unfortunately, I would say we haven't discovered much more than that, but there are more clinical trials to try to treat addiction in different modalities. The way I see it of how you're supposed to treat mental illness and addiction is in a mind, body, and spirit situation. You have to be connected with yourself. You have to see a therapist. You have to see a psychiatrist. Sometimes medications are needed. Sometimes they're not. But you have to create your own safety net, your own group for you to get better in whatever you're struggling with.
I was just going to say about what you were talking about, Dr. A. I sometimes call her Dr. A. Is about the nucleus accumbens. Like I always say that, many of us have the Midas addiction touch, right? So instead of everything turns to gold, everything turns to addiction, right? Whether it's a chemical dependency or a process addiction, which, another way of calling a process addiction is like the internal drugstore, right? And I would say that it's, the other thing we say is we call it like a pop-up game, like that whack-a-mole game. It's like you put one thing down and pick another up. And like food and sex are very much play off of each other. When you put the food down, the sex spikes. When you put the sex down, the food spikes, and so it's watching in my life. I've been involved in, it's probably 5 or 6 different, recovery groups.
Probably more.
probably more. Yes. From the doctor witnessing my life. I think, right. You saw me when we first met and you just said, wow, how disciplined this guy is. You're so disciplined, and, off of drugs, alcohol, caffeine, nicotine, flour, sugar, sweeteners, sodas, all these things. And she's just like, how do you live such a clean life? And it's not discipline. It's really necessity, and having done all this work, you build a base, and a base from which, you don't want to leave. And I have had slips within our relationship with certain things, like food, for instance, and you see it and like the beast just spikes, right? And you gain 8 waist sizes, 100 pounds, 9 cavities in and it's like, it just goes crazy. And then you dial it back, but it's a constant process. And Dr. A, I would love you to say more about when you talk about working with the nucleus accumbens and regulating that over time. What do you see, like, especially like looking at my life, at your husband's life, like, what do you see this trajectory is? Because to me, sometimes it feels like, and even for my clients, right, it can feel like this is a hopeless journey, like it's just going to move to another thing. It's always going to be bad. Relapse is always around the corner from something else. Like, does the brain ever really find some level of ongoing stability?
Yeah, so we do. Thank you, Andrew, for that. And before I answer that question, I do have to say that psychiatrists, we learn a lot from books. We're book smart, we can reread. And some psychiatrists have personal experience from being themselves in recovery. Some don't, not just from substances, but from other things. But I had the great, amazing opportunity of having my husband as my guinea pig, as the test rat in the laboratory. And when I met you, Andrew, you were 13 years abstinent from all these things that you just mentioned. So for me, as a psychiatrist, I kept being curious, like, can he just have a little sugar? Can he just have a little paella when we're in Spain? What's the worst that can happen? And so it happened. The worst happened.
Wow.
I just gave a little, like, just 1 scoop of rice or paella, and the monster that he's talking about unleashed with and finishing 4 paellas in one sitting, one whole big paellas. And with that, I was like, wow, I just kept staring at him in the table, like, that's what addiction really is. A person with addiction cannot just have 1 grain of rice. They will devour the whole, a sartén, the whole plate. and leave you staring with nothing. And, I would say 60, 80 pounds later of struggling with that, he got it back and he started doing his recovery work again. But it was beautiful. As a psychiatrist, it was beautiful to see that,
You,
the chemical imbalance, the change in the brain that happens so quick,
you're saying it's
right?
one thing to read about it in a book. It's another thing to see your husband right in front of you experience this behavior. Yeah, very interesting. Yep.
Right. As a psychiatrist, you're fascinated. But as a wife, you're like,
Yeah.
holy, how much can he eat? When is he gonna stop?
Great, great. All right. Well, let's circle back, Yesenia, to something you talked about before, and the idea that the primary psychiatrist arsenal were the SSRIs and sort of the other more standard drugs, but now we are segueing into the field of psychedelics, right? We're segueing into the idea that psychedelics may be effective. So obviously, there's been a lot of research suggesting that MDMA in combination with psychotherapy can expedite healing or reversal of depression, anxiety, PTSD. However, recently an FDA advisory committee failed to recommend MDMA with assisted psychotherapy for approval. And this was a really harsh public reckoning, it seems to me, but I'd be curious what your thought is over the drug's future and drug combinations with psychotherapy's future, psychedelics future, and really for the whole psychedelic community. So what's your take on this whole thing, and do you feel that there's hope for this sort of treatment in the near future?
Yeah, well, I remember when the news came out that MDMA was not FDA approved for PTSD. Dr. Phil Wilson, psychiatrist, is a prominent pioneer, educator of psychedelics. I had the opportunity to train with him and Bessel van der Kolk, and everybody in the community keeps close contact after the training and all that. So I remember him sending an email like, "This is not fair. We have to continue fighting. Like MDMA is such a great psychedelic for anxiety, for depression. Like, what is the FDA? What are their thoughts?" Well, that's great that he's supportive to pass MDMA, psychedelics, to have another modality to treat our patients. I believe that the study just basically they didn't have enough data to show that MDMA was indeed good for PTSD. And I mean, if you think about it, psychedelics are very, very difficult to study, right? You have an experiment with real patients with PTSD, and you have to give them two medications. You give them a psychedelic or aspirin or a placebo. If you take a psychedelic, are you going to see or feel the difference if you take aspirin versus psychedelics? Of course, right? Anybody can tell.
So you're saying it's really impossible to do a placebo-controlled trial because people can tell. I mean, you can administer a placebo and you can administer, but the patients are going to know. Sorry, I guess it's impossible to do a blinded trial because the patients are going to know they're
a double blinded, right? Because also, I mean, you can tell the patient, you can do it a blind experiment, single blind, that the patients wouldn't know, but of course they will feel, and the researchers are going to be in front of them acting in different ways. So it's very difficult. I wouldn't say it's impossible, but I think it is very difficult to have, let's say, an experiment with two different kinds of psychedelics using LSD versus psilocybin, right? Ketamine, which is now FDA approved, versus MDMA. That would be more of a fair because they will have similar behaviors, feelings. Then now you will wonder like which one is better. But of course, there's a lot of legality involved with that. So yes, it's not ideal that MDMA was not approved. But I do think that it was the faultiness of how the experiment, the research project was created. And not only that, but they also talked about the benefits versus the risks. What were the risks of taking MDMA, also known as Molly, ecstasy on the street, right? Well, some people have palpitations.
Yeah.
Some people have arrhythmias.
Yeah.
High blood pressure, right? So you have to take into consideration that a lot of people who are seeking help from MDMA, from the connection, going back to the connection, right? They have other problems as well. Some people can have psychosis. Some people have substance use problems, addiction problems, right? So to just give MDMA like candy or approve it to everybody wouldn't also be a responsible thing for clinicians to do that to their patients. So while I'm not happy that MDMA was not approved, I do hope that research gets more creative and that we're able to do more clinical trials to really study this beautiful psychedelic MDMA.
Yeah, that's great. That's great. That's very helpful. So let's segue to Andrew, and Andrew and your work. So I know Jody told me about the work you're doing with meditative techniques with your clients. Meditation calms the mind and intellect down so people can have a more profound and expanded experience. Share your work in this regard with our listeners.
Yeah, I would say our work really is a long-term comprehensive wraparound care. As a consultancy, we direct people to resources. So we see the whole journey for someone. We have a vast array of resources at our hand, from residential, hospitalization, outpatient resources, wealth management companies, detectives, lawyers, therapists, psychiatrists, like this whole thing. And so we really build, bespoke programs for people and their families. And of that, our services can be coaching, mental health, life, recovery coaching, executive functioning coaching, companioning, where somebody lives in your home with you 24/7 and recreates or models an inpatient structure and supports you where you're at. We also do interventions, acute psychiatric interventions, as well as, substance use disorder interventions, dual diagnosis. Dr. Almaguer and I will do that together. But when you speak about meditation and meditation practices, that is definitely something that we find very valuable. And we will have our coaches or companions do that with clients, and they rely on a number of different practices, but also heavily their own, as there is a real peer-to-peer aspect to the work we do. A lot of our coaches and companions are people who have lived the journey that they're then helping somebody else go on themselves. So that is something that we do with them and that we also rely on as a referral resource. I'd say for me personally, through the course of my life, meditation has been very, very important. Yoga, cold plunges, all of that has been a deep part of the work. I wanted to just jump back real quick, if I can, to what you said, Dr. Almaguer, in response to David's last question about psychedelics. I am finding in my work that the more we move forward, there is this divide that we've had between substance use disorder and trauma and also mental health. There's been this, and this is what's been so interesting in our work together, Dr. A and I, and with the people we're seeing nowadays, it's not separate. We're seeing that it was never separate, but it's really not separate. And our system has been so broken as far as treating it. Places are usually licensed only in a singular fashion. And as far as mental health treatment, you got like a short-term 72-hour hold or a week-long stay at a hospital, but there's nowhere really public that can, or insurance-based, that can take care of you outside of that. And if you want to do something longer-term residential mental health or dual diagnosis, you have to pay out of pocket, and it's expensive, right? So we've really been studying this connection, and we do feel like instead of people going to rehab for substance use disorder, they're going to go to rehab in the future. At least insurance companies are going to list it as for untreated trauma, because it's trauma underneath all of it. But psychiatry, therapy, insurance, our treatment system, our mental health care system has not understood how to treat both at the same time. Because the old thought is you have to get your system stable off of the substances in order to do the trauma treatment. And then from trauma therapists, somatic therapists, their side of things, you can't get off of the substance, the crutch, until you've treated and regulated the trauma and regulated the nervous system. So there's this active dialogue that's happening. And I really, a lot of the work that we do nowadays is harm reduction. We're not necessarily even doing sobriety anymore. So when I think about, like, obviously the abstinence is a huge goal. It's been a part of my personal journey. It's been one of the bastions of what we do as a company and how we try to support people. We definitely think it's the base of things, but it's not the end of things, right? And we do have to explore this recovery journey further. And I do want to speak back to psychedelics and how it relates to meditation and how it relates to the intersection of these three things, because I have seen, like, both personally amongst my peers in recovery groups, amongst our clients, amongst our friends, that people can reach a decent level of functioning and stability and still not be okay, and still really struggle in their life and their relationships. I've seen people 25 years sober, great relationship, husband, wife, kids, successful kids, great job, good earners, have a full life, and still irritable, discontent, unable to fully connect, unable to enjoy life, unable to take the good in, unable to see themselves as somebody adequate and worthy of attention, love, and care. And I've seen psychedelics work magic with these people. I'm not saying it's an end-all be-all. I'm not saying it's a panacea. I'm not saying that it's a miracle. I really want Dr. Almaguer to speak to this next, but psychedelics are really being misused. I think I was having this conversation recently with another incredibly interesting psychologist you should speak to, Dr. Chantel Thomas out of Madison, Wisconsin as well. But it's we always try to go back to these ancient cultures, go back to Oaxaca or something like that. But that's their culture. That's not our culture. And so it's not just about the appropriation aspect. It's also about they can't advise us accurately. So, like, if you go down to, say, Oaxaca to do a mushroom journey, they're going to tell you, you should get off of your psych meds. Psych meds are toxic and they're poisoning your brain, and you should smoke marijuana instead. Santa Maria, you should smoke Santa Maria. But they don't understand that those meds are keeping somebody stable from a psychotic episode or from, a schizophrenic, manic episode. So that's been one thing. And then I think also we were saying how, like, this movement has really happened without therapy. A lot of people are just, some emergency, ER doctor who's running a clinic in Manhattan, who people are just coming in to do, like, IV ketamine and get blasted out of, to an ego death state with a nurse over just watching them. And then they come out of it and they stumble into the subway and go home. And they're not doing it in conjunction with therapy. So they're missing the benefits. They're missing the huge benefits of the medication. And again, like, with the right therapy, the right practitioner, the right medication, it can heal treatment-resistant things in even highly functioning people who have long-term sobriety and mental health. And it's really, I don't know, Dr. A, jump in, help me out here. I mean, this is something.
Well, this is great, and I actually think it can segue us into my penultimate question, and then we can sort of segue to the last. So I think it's a perfect segue to this next question. So your practice sounds just so fascinating, and the SOHL clinic, in general. Tell us about, either one of you who wants to take it, tell us about how your clinic works in this integrated fashion. So you've got a psychiatrist and you've got an addiction specialist. How how do you guys work in an integrated way? How does the Soul Clinic, work as a consultative, this very innovative consultative business to help people?
Yeah, thank you, David. I believe that a lot of education is changing. Nowadays, there's schools that are focused on what the person is good for, mathematics, science, right? And I make that reference to say that soul is something similar, that I bring more of the left brain, and Andrew
Mm.
brings more of the right brain, the
Yeah.
creativeness. Andrew brings the recovery, the experience. I bring the science behind it. So when we created this company, Soul Coaching, Case Management Interventions, I found out that Andrew had already been doing this for many, many years in LA, New York. And I said, you do coaching and you live with people while they're recovering from substances?
Yeah.
I was doing my residency in New York City in the Bronx. They said I need to have these services, interventions,
Wow.
coaching for my patients.
Yeah.
And Andrew says, "Well, it's usually not covered by insurance." And then I said, "How amazing is it that you have a whole team to help your loved one get to treatment, intervention? They go to the intervention. We work with the family, the wife, the children, while their loved one is in treatment. And whenever they're ready to come back home, you have to do the proper aftercare plan. 99% of the times, people relapse because they don't have a proper aftercare plan. So we make sure that every patient that gets out of the rehab has a psychiatrist, a therapist, a coach, and a case management, and that everybody talks, everybody's connected, which is what's lacking in this network that we have. Your psychiatrist doesn't talk to your cardiologist, to your therapist, to your urologist. When everybody's connected and they see the person as a whole, not just of bits and pieces, the person really gets better. And it's a very concierge, very we put a lot of meticulous work to find the right fit for the patient. If we have a young 30-something-year-old female that's Latina like me, that maybe I prefer somebody that speaks Spanish because that's my first language, and then you pair me up with an 80-year-old psychiatrist that is from Russia, like there's not going to be any connection in that, right? So we really find the right coach, the right psychiatrist to be in the team that is going to move the patient forward. And what I would say is that a lot of the times Andrew and I get into a lot of discussions because we have different lenses, like you said at the beginning of our conversation here. But that's the beauty of it, that whenever I'm able to hear his perspective and he hears mine, we always get to a common ground to really move it forward.
I love it. I love it. Andrew, anything to add on that?
Yeah, it's creative processes are not always easy, and I'd say that we do really get into it, the two of us. And out of that alchemy, we're able to really create something that we really value and that's different and we feel is valuable. Yes, our services, it's so difficult for people to understand what we do. And for when you get on a call with somebody who's in crisis and they say, I need the name of a rehab, I need somebody to come and help my son. They don't understand that it's not just that one piece. Right? The relapse rate of people going to a 28-day insurance-based rehab is like 95%. It's not just that. It's not just getting a coach in the house to tell you, tell your loved one what your parents have told you, but you don't listen to. That's not going to work. That person's going to go in the house and they're going to say, you're just treating me just like my parent. I don't want to talk to you. So it's really what our thing is it's a long-term vision. Like we see the whole playing field. And what we're doing is we're shaping, sculpting, curating, preening that journey over time, which means that we're introducing different resources, coordinating those resources, overseeing them over time. So when Dr. A is talking about connection, she came up with our name. SOHL is the word soul, but we took the U and replaced it with an H because of the belief in the human connection to heal the soul. So we really saw that it wasn't necessarily the provider that, or the modality or the program that does it. It's really having a safe, secure, healing connection with somebody. I mean, we're hurt in connection with people, we are disconnected, and we heal in connection. That was our experience together. When Dr. A and I met, we healed disconnection and trauma in our own lives. And then we built this company to do the same for others. And we, as she just said, we replicate that connection across our entire framework. A lot of companies say like they're like a staffing agency, right? Give me a coach, give me a companion, like send them in. But there's nobody supervising that coach or companion. There's nobody talking to the family. There's nobody who's behind that coach, who's protecting that coach or companion or interventionist from working specifically with that client. If that coach is talking to everybody in the system, then that client feels like their alliance is being broken, is being stepped on, right? So we not only do that, but we also coordinate the clinical team and make sure they're all talking, right? Because traditionally, like a psychiatrist is just in their silo, right? And they get the information they give meds, they do a 15-minute check-in, and then they're on to the next. And they don't have the therapeutic information. Sometimes even if they're doing psychotherapy, they don't have the information of that client on the ground, or the parents, or the nutritionist, or whoever else is involved. So we oversee that, And for me, it was really a change. Like I worked in Los Angeles for years doing these jobs and with companies. And I saw care was so fragmented and not successful. And when I got to New York City, I met clinicians like Dr. Almaguer, who really worked in this concierge, hands-on way, outside of traditional private pay, outside of traditional insurance billable hours, and how well that's able to support someone. And that's the way that she works, and why I'm so happy that we're able to collaborate. She has her private practice, which provides clinical services, and then SOHL provides non-clinical, long-term comprehensive case management services. And so she's able to take on a core group of patients and work very hands-on, communicate with all the different people, oversee that process. And as her work as an interventionist with us, we do interventions that like few people in the field are doing. And I feel very confident about saying that. Many people who are doing interventions in the field are doing classic substance use disorder interventions, where they're sharing their personal recovery, they're showing up and surprising them like the A&E TV show, they're reading letters, and then we're going to scoop you and take you off and drop you off at a 28-day rehab. Our interventions are less of an event and more of a process, especially mental health interventions. It's a longer term piece. And the first part of the intervention is working with the family, really, and getting them on board, right? And educating them. And so for me to have her as a psychiatrist working with me in that process, she's not doing med management or assessments with the people we're working with. She's supervising that whole process with me. So when you get back to your original question, when you say like, what is that we do? It's like we're supervising a long-term change process for an individual and the entire family system that they're connected to.
I love it. That's great. All right. Well, the last question for both of you, for each of you. So we always ask our guests to comment on the ego, the notion and the concept of the ego. So I'd like you each just to share your thoughts on what do you feel the ego is, and how does the ego serve to disrupt our perception of reality? So Yesenia, why don't you go first, and then Andrew can take us out.
The ego. What can I say about the ego? Sigmund Freud, one of my favorite people in the world, the founder of psychoanalysis. He believes that the ego operates based on the reality principle, seeking to satisfy internal instinctual needs in a socially acceptable way, even if everything that he did was not all that socially acceptable. The ego for me is a person's sense of like self-esteem, or self-importance in themselves. It is the part of the mind that really mediates between the conscious and the subconscious, the conscious and the unconscious mind, and it is responsible for reality testing and solving one's problems. That's
Yeah.
ego for
Yeah.
me.
Andrew?
That's so funny. That's why we're together.
I'm thinking you're going to have a slightly different take. I'm just a guess. Just a
You've
wild guess.
learned me well. Your neuroscience has scanned me and learned me well. Yes, I mean you are the left side, Yesenia, and I am the right. We are so wildly different. And yeah, I really, Dave, it's so interesting. I was just talking to somebody today about New York City, right? We're in Dallas right now because she's at UT Southwestern doing an addiction psychiatry fellowship. So we're in Dallas for a year, ostensibly, right? Yeah, we
What's coming? I am nervous now.
no, so
we got to get to the ego, Andrew.
yeah, no, I know. I'm just my ego's all over the place. Was just talking about New York City today. I mean, New York City is the greatest city in the world. It's my favorite city. It's my home. Well, I always say my first home is with Yesenia, and my second home is. But it's. I was talking to somebody about this energy. Everybody loves the energy of New York City. That's what they always comment on. They're like, "There's so much energy. I love the city." And for some people, it's overwhelming, but it's great energy. And I was really talking about this with a friend as well, and we were saying that like that energy is ego, right? That is ego. It's like this sense that, if I can make it here, I can make it anywhere. Like I'm making it, I'm doing it, I'm going through the streets, I'm taking the meetings, I'm hustling. I'm walking on the sidewalk flooded with 100 people, and you better get the hell out of my way because I have somewhere to go.
It's the best of us. It's the best of us and the worst of us.
What's so interesting? We always say that too. You're going to see somebody having their best day and their worst day of their entire life. And that span that, we created our company SOHL during COVID. Like we had just met, we just created the company to serve so many people who were, disconnected and destabilized. And it was just so interesting because as we came out of COVID and started growing, that intensity of the city fed our company, right? It fed us, it fed our lives, it fed our company. And I feel like that's the beautiful thing about the ego, is that it is individuation. It is understanding ourself and being a thing in the world. Obviously, my belief is that we're all one, we're all connected. I am like molecularly so different. I'm so similar to this wall over here, like my atoms, my genetic code. I could probably said that better, Yesenia, scientifically, but it's just, she's always correcting me. But it's just, my beliefs, we're so connected, but that I need that ego to get things done in the world, to be something. I think a lot of people think of the ego as a negative thing. Like I have to get out of ego, like I need to smash ego, like I'm being so egotistical, which is synonymous with, being selfish, being self-obsessed, being a narcissist, all these things. But I really see ego, sure, it's that, but I see it in a different way. Like you were saying, Dr. A, is like I see it as this thing that helps me get stuff done in the world, that helps me be a thing, that helps us have a relationship to each other, that it is like she and I are the same, but we're different. And we both get things done in a different way together. So for that way, I find it beautiful. The way that I find it difficult, right, is that in New York City, rushing around, being an ego and getting stuff done is incredibly exhausting, and it's like that energy of New York City is also fight or flight. You're constantly in fight or flight mode. And now that we're here in Dallas, it's so much calmer, and it's been like really wonderful to have 5 rooms in a house and never need to leave. It's like, it's so, and in a way, when I go back to New York City, it's kind of like I have to step back into more ego in order to survive, in order to not get tread upon in the streets, in order to like get in the subway, get on it, packed with people, get off. Like I go back into that space. But here in Dallas, outside of the city, it's interesting. I kind of feel like, so much of psychedelics is melting. Like I feel like I melt.
An ego. So you have experienced ego death while in Dallas. Is that
While
what
in
you're trying to
Dallas.
tell
That's
me?
a great title for a book, Ego Death While in Dallas.
Dallas, that is a
love
great
it.
book. I feel like that would, yeah.
So what
like,
you're saying is that you want to move back to New York.
I would love to be more egotistic.
All right. All right. Well, Andrew and Yesenia, thank you so much for joining us on Exploring Reality Maybe. We really appreciate it.
Miraculix is a small and independent company that has created the first quantifiable home test called Q-test for anyone taking mushrooms or psilocybin, LSD, MDMA, and any other psychoactive substance. So think about this. You're at home, you're with friends, you're hanging out, and you're experimenting with these amazing psychoactive plant medicines, and yet you don't really know the dosage. Miraculous is here to help you really have a positive experience so that you don't overdose. Created by Dr. Felix Bell of Germany, please go on our show notes and order this package. They're now available in the USA, and we couldn't be more excited to represent this home kit because we want you to have a truly positive experience with psychoactives to explore your own reality and the way these psychoactives can help you in your life.
Exploring Reality Maybe is written, produced, fact-checked, and edited by Jody R. Weiss and David Schwartz. Research support is provided by Semicolon Connects. Music produced by Nextbox. Visit our website at exploringrealitymaybe.org to find show notes, transcripts, bios, and to learn more. If you like the show, please visit our website to donate.